Hi everyone, welcome back to another video. And for those of you who have not been to my channel before, my name is Ben. I'm a trans guy and I'm also a third-year medical student. And as we all know, today we're talking about how to ask a sexual history. And we also all know that my face and my personality are recognized forms of birth control. So I decided I needed to bring in somebody else to talk about sex who knows a little bit more than I do. So I have today Arden of Eden. If you'd like to go ahead and introduce yourself.
Yeah, I am Arden of Eden. You can find me over on Twitter and some other maybe naughty sites under a similar moniker. I do sex work and I talk about trans rights over on the Transatlantic Show on the Line channel on the YouTubes. So I'm doing trans advocacy. I do like a little bit of sex work advocacy, and yeah, that's my thing.
Yeah, so kind of we're approaching this from two different angles here. So my side, obviously, I'm a trans guy and I'm in the medical field. And then we have Arden, who's a trans woman who comes from more the patient perspective and also like, so
And
I think we're gonna, I was trying to be nice, trying to be professional. So I think this will be an interesting conversation. We're just going to approach some of the questions that I've been asked by a lot of you about taking sexual history, and hopefully this is helpful for all of you. So when we take a sexual history, of course, this is going to fall in with the rest of our history and physical that we do every single time. And of course, we'd get our demographics, which if you haven't watched that video, shameless plug, go watch my video about how to ask demographics. So we'd ask all of that. And then, of course, typically when people are coming in, they're going to have a chief complaint. And we might, for everybody, we might ask something like about sexual activity just generally. But more often, people are coming in with a specific complaint that we'd need to ask more detailed questions about. But people are often like feeling shamed or embarrassed about talking about this kind of anatomy, and probably related to purity culture and lack of sex education that we get. So how can we make our patients feel more at ease with being honest with us about their symptoms?
Yeah, so I mean, I think I've heard some doctors talk about this, and I definitely heard you talk about this. I think a good start is kind of like maybe cracking jokes about it. Like, I don't know, maybe you can be like, I know we don't know each other that well, yeah, but I have a few questions for you, or just something, I don't know, maybe that crosses some sort of line to you, but I feel like it's a lot better to kind of maybe break the ice a little bit and like have the doctor acknowledge that maybe it's also uncomfy for them to be getting into these topics, like, and they realize that it's probably going to be uncomfortable for you to start talking about this thing, but that they're here to, it kind of fosters that sense of like, we're on the same page. You know, I might be your doctor and I might know a little bit more about like some health stuff than you, but like we're both on the same page about how this feels.
Yeah, that's a good point. And also just something that I'm sure you probably have some opinions about, but especially with medical students who are just awkward in general and don't know how to talk to anybody at all. People who often we get a little nervous to even say terminology associated with sexual anatomy. So like even being able to say penis or vagina is weird for some people, which is funny because like we can talk about that in anatomy class all we want, but then for some reason, when we get another human in the room, we're no longer able to communicate like that. I guess that's something we need to get better about, just like using terminology and not being afraid to make that language commonplace.
Yeah, I think in a similar fashion to making jokes, it might be helpful to do like some sort of preamble, like especially if you are aware that your patient is like trans or something, you can be like, hey, like I know that these things are uncomfortable to talk about in general, but especially if you're trans and maybe like you don't even like aren't comfortable with the words that I'm going to use, I'm just going to kind of barrel forward recklessly. And if like at any point I use words that you don't like, or I use terms that you don't understand, like please stop me and ask questions, because like what matters here is like the truth of the matter and your health. And you know, but we'll get through it, this whole situation together, kind of thing.
Yeah, and that kind of leads us pretty well into the next question, which is about trans issues. So, how do we have a discussion with trans people with regards to sexual organs when it's warranted? I guess we'll start with that, and then I'll go into the second question.
Yeah, I think like, so my gut instinct is to say like, you should just use like the most like sanitized biological words that you can for the parts that are there, and like, I don't know, kind of leave room for like the patient to maybe like hop in and be like, excuse me, kind of like the preamble I did earlier of like, it might be useful to just say like, so I need to ask you some questions about your sexual history and about like your body and stuff. I realize that these could be like triggering or uncomfortable. So if at any point I use a word that you're like, I really hate like talking about my body like that, like doesn't matter what word you use. What matters is getting, again, to the truth of the matter, to the truth of what's going on with you and your body and your health. So like, I think really making sure that the patient understands that like you have like a flexibility and like how you can communicate things, as long as you are both on the same page about the ideas you're communicating.
Yeah, I think I'd agree with a lot of that. But I've talked to a lot of doctors, and I've seen doctors like dumb down the situation for people, and it's really cringy. Like, I don't know why they feel like they need to explain to me what anatomy I was born with, but like I've had people say like, oh, well, since you were born female, you have a cervix and you're going to need regular paps. And it like, yeah, I know that. Like, I don't have some weird delusion where I think that I just like got rid of my uterus overnight. So have you experienced anything like that?
Not quite. To be fair, my medical interactions since transition have largely been limited to like gender clinics, where like the most that they'll do is they'll like take my labs and stuff. I'm not getting like full exams or anything. But I can definitely, like, eventually I'm gonna have to have certain exams that I'm not too thrilled about, and I'm sure there's gonna be like an awkward conversation or something there. Um, I I just feel like really like the goal should be communicating to the patient like that, like you have like empathy for them and like that you care about their health. Like I feel like when you kind of come in and you're like, well, little child, in case you didn't know what organs are in your body, then this is what the case is. Like it kind of feels like you don't really care about my health, and like you just care about like finishing your exam, like completing the objective. I think if you really communicate to the patient that like you are there with them, that you care about them, that's I think what most patients feel like they're lacking from their doctors. Like I'm just kind of like a number on a chart to them, which I understand. I understand why they would feel that way. But yeah, when doctors are more personal and they are more invested in my personal health and my personal well-being, those are the kind of things that I feel like build rapport and trust, to know that like, oh, when this doctor uses this word, he's not doing it to hurt my feelings. He's doing it because he wants to make sure that like I don't have like some form of cancer or something, you know, or like to be there for like my health.
Yeah. So in cases where we do need to perform some of these more invasive exams, how can we walk a trans person through the procedure without, I don't know, inducing dysphoria or just making them feel like traumatized in any way?
I feel like this is a hard one. I feel like inducing dysphoria in a lot of these exams almost seems like the likely outcome. I think maybe it's worth having some sort of like, especially if this is like a family clinic or something, like if there is like a psych person on board, like to be like, just let you know, this procedure is like really uncomfortable for a lot of our trans patients, but if you want, we have someone here who can like talk to you afterwards to make sure that like we can navigate through this, and we're not putting you through like such significant distress that like we are like causing harm to you, because obviously the goal is the patient's well-being, not to like have a net negative.
Absolutely. And I guess this is like a good point for me to talk with the audience about, like, because yes, a lot of times we like to separate trans people from cis people for some weird reason, but we're all people. And a lot of the things that you can do to make someone feel safe, the ways you might make a trans person feel safe are a lot of the same ways you'd make a cis person feel safe. For example, with a cervical exam, it's important that you always talk before touch. Like, that's the biggest thing we're taught is you're never going to put your hands on somebody without making sure they know what you're doing at all times and why you're doing it, making sure they can see your face at all times, making sure that we're using appropriate language, such as you're not telling somebody like feels good, because that's really unprofessional, and we don't want to say things like that. So always like appears healthy and normal is the way we talk about that kind of thing. And I mean, these kind of things they're invasive for everybody. Like, right. I've performed a lot of these, and like cis people are not any less afraid of it, with the exception of some cis women might be more comfortable than others, but after childbirth. But like, I mean, it's hard for everybody. So, I mean, I guess don't overthink it. Like, to my medical friends out there, I guess the more afraid you seem to be, the less secure your patient's gonna feel. So,
definitely. Yeah, I feel like having a doctor who's like confident and knows, like, it feels like they're going in there to achieve the goal of my well-being, and not to be like, oh, this is another body that I have to invade. That's like if the doctor's intimidated, that makes me feel not safe. But when the doctor is just like, yep, we're just going to do this, and it's not going to be a big deal, that makes me feel comfortable.
And make sure you're getting consent for everything. Because even if something is necessary, does not mean the patient wants it to happen. There are risks with not undergoing a certain procedure, but at the end of the day, if somebody has some reason why they don't want to do it and they're willing to take the risk of not doing it, that is something that needs to be respected.
Yeah, I think maybe something that I kind of have felt before, not that I can't remember like a specific story, but definitely I do feel like there have been times where I wanted to opt out of what was like the recommended thing, and the way that the doctor explained to me what the risks were kind of felt like I was being guilted into doing it anyway. So I think maybe kind of try to be really careful to approach that and be like, yeah, like, I'm totally fine. We can stop it right there if that's what you want. I do need to let you know, just for like, rules sake, that me not doing this puts you at like risk for X, Y, and Z. And like, that could become a problem later. But like, maybe like also being like, but here are some tools or signs that you can look out for in case that happens, so that if it becomes a bigger deal, you know what to do about it and you're still looking out for it. Rather than kind of being like, well, fine, I won't do it, but just let you know, like, you could be totally screwed if I don't like invade your personal bubble. Yeah, no guilt tripping. That's kind of shitty.
And that's actually something I just thought of. Let's say if somebody declines like a testicular cancer exam, which is recommended for people 15 and older, all of them. But let's say someone declines for whatever reason. That's a time when you can teach somebody like how to do a self-exam, like describe, this is what you would be looking for, so that you don't have to worry about me getting involved, but in case something does happen, here's what you can be on the lookout for. And that might make somebody a little bit more comfortable.
Definitely. I think that does a way better job of empowering your patient. And I think that probably even like increases the likelihood that at like future visits or whatever, that they'll be more willing to like trust you to do something, because they know that you're not going to force them into anything, that you're genuinely there for them.
Yeah. So I think that kind of brings us into the next segment, kind of all about actually asking sexual history. So sexual history is asked with the rest of the social history. So anytime we'd ask about occupation, your travel history, any like alcohol, drug use, like anything pertinent to lifestyle. So we were kind of taught a few specific questions to ask. And so I just wanted to get your opinion on how effective are these questions for gathering the information that we're looking for with them? And are there ways that we can rephrase them to reduce any stigma that might be associated?
Yeah.
So does that sound good?
Sounds good. Let's dive in.
Yeah. All right. Well, let's just get to the meat of the issue here with the question, are you sexually active?
Yeah, I know we kind of talked about this before the show a little bit. We have notes, and I definitely agree with kind of like with what's in here is talking about the fact that like people have very different concepts of what it means to be like sexually active. There's like so much disparity like on individual perception of that. And I feel like this question kind of runs into the same issue that we're running into with like a lot of like trans like access to healthcare, where like these terms are so vague sometimes to kind of avoid our purity culture discomfort with things that they actually miss the point a lot of the time. Like we're talking like feminine hygiene products, like that's vague and kind of offensive and doesn't talk about what they really do. We're talking about like, are you sexually active? It's kind of vague and misses the point. Like I think it's more useful for maybe doctors to be a little bit more direct about what information they're trying to gather.
Yeah. It was like the notes I kind of added were like a lot of people with purity culture and lack of sex education think that sex equals penis plus vagina and that there's no other way to be sexually active. So you might ask somebody, are you sexually active? And they might say no, because they might have had oral sex and they don't consider that to be sexually active. Right. And especially with things like HPV and oropharyngeal cancer, which are big and like really hard to catch. Like we might rule them out because we'll just say, oh, this person's not sexually active, no risk. So how do you think, I guess, like if we were to be more direct, do you have any suggestions on how we might phrase the question?
I don't know if I could say what necessarily phrasing is the best, but I feel like being really clear that like any sexual activity is valid here. Like we're talking about oral sex, like anytime your bodily fluids are mixing and matching with somebody else's in some capacity, that is like a risk factor, and there's something there to like start talking about. So yeah, I don't know, like if there's a way that a doctor could, in like a non-condescending way, give like a bit of like a sex positivity, sexual health lesson about like, yes, now we're going to talk about like your sexual history and what we're getting into that. Or we really want to know like anything sexual, like anything intimate you're doing with another human being that could like put you at risk. Yeah, I mean, that's a good question.
Do you think it might be more effective if we, like, should we split this question up into like more direct categories? Like, are you engaging in oral sex? Are you engaging in, like, do you think that would be helpful, or do you think it'd be too much?
I think as long as there's no like stigma associated with those things, because I definitely have had in the past, like pre-transition after having sex with men, had like stigma about what that could mean for my risk factors and things like that. I think as long as I can say like I'm having anal and oral sex and there's not this like, oh gosh, well now you basically must have like some series of diseases or anything like that. I think maybe if like I don't know what the best way to phrase the question is, but I do think being more direct about like what sexual activity entails would be good, because I think that is most likely lost on a lot of people.
That's good to know. So the next little point for this question actually came from a Twitter post this past week. Yeah, so the case was somebody, it was, I believe, a 16-year-old female presented with prolonged menstrual bleeding. And the doctor said, I guess like when they, I don't know if they admitted the patient or what, but the initial doctor's handing off to a second doctor. And the first one like asked about like sexual history. And the first doctor said, well, she just looked too innocent to be sexually active, so I assumed she wasn't. So what do you think about that?
Yeah, that's awful. That's such like red-pilled, like incel sounding bullshit. Like I'm pretty sure my understanding is that like most kids are like exploring their own bodies from a very young age, like on average. So like the notion that someone doesn't have some sort of sexual health risk because they look young and innocent is absurd. Like and sexist. So I'm assuming the doctor was a man. Maybe that's wrong of me to do, but
Most likely.
yeah.
But the fact that they might be missing something very critical, like, I mean, she's young, but like cancer is a risk. Like, especially like any abnormal uterine bleeding, like cancer is a huge risk. So the fact that doctors are willing to let like assumptions and stigma stand in the way of doing their job is kind of frightening.
Yeah, for sure.
Or like an ectopic, if they miss an ectopic, like that's immediately dangerous.
Definitely. That's really unfortunate. And I hope that that patient was able to get the care she needed.
Yeah, that doctor got dragged through the mud on Twitter, so I think we're okay now.
Rightly so.
So the next question, kind of going along similar lines, is do you use protection? And usually they'll just leave it at that. They won't even ask anything else.
So this one I think is not the phraseology of the question that's a problem. In my experience, like I've said, I'm a sex worker. I've had a lot of unprotected sex in my time, and most of the time it's been safe and precautions were taken. But still, generally afterwards, I like to get tested to make sure that everything's okay before I move on having other partners. I have definitely had a notion of doctors who kind of look at you when you say you don't use protection or that you might have had any sex that was potentially risky, as if you're kind of like stupid and like foolish for willing to take a risk. And it's kind of like, well, sure, there's definitely a higher risk there. There are precautions you can take to be safe. And if that's something that is like for me career-wise is relevant, or for just me personally, if that's just what I like, that's my fucking business. So I do think it would be maybe what we're seeing is needed here is like a deeper sort of education on sex positivity for doctors, like on like sexual shaming and sexual, like what a lot of like America's predominantly Christian, like Protestant Christian. Maybe the issue is that we need people to be like aware of like religious trauma and how that impacts like sexuality and things like that. Like there really is like a sense of, I understand that using protection would make me safer, but maybe there are a variety of reasons that you could conceive of why that is not good for my situation in particular. And being able to be like, okay, great, that's fine. So would you like an STD panel, or like do you want testing? Like is there anything that we can do to make sure that you feel safer considering that's the case? That would be great, rather than sort of like a judgmental, okay, tick that box. This patient's a slut. Like, thanks.
Yeah, and it's kind of scary, the thought process we get into with a lot of these assumptions that we have. I know, like when we're going through somebody's history, especially if like we have a 15-minute visit with somebody and we just like need to get in and get out. Like there are certain things you hear and we're trained to like, kind of have a light bulb go off in our heads. Like, oh, like being this is prostate cancer, being this is like something else. Like things just kind of go off in your head. And a lot of times for people, like unprotected sex is like a light bulb for STIs, and it shouldn't be that way. But we still let that happen.
Yeah, and because I have had probably more unprotected sex than other people, like I appreciate when doctors have been like forthcoming and like non-judgmental about me being like, and I would like to have like my blood drawn for an STD panel. That would be nice. I think it would almost be worth doctors being proactive about that on their side. We're like, I don't even have to ask. They could be like, oh, cool. Well, if that's how you want to do things, that's totally great. We want to support you and make sure that you are given the resources and empowered to like be your healthiest and best self. Would you like one of these resources to make sure that if you continue doing that, that you're still healthy and safe? But I felt like in the past, a lot of the time I have had to be my own advocate. The doctors just kind of were like, oh, that's gross, and kind of wanted to move on. And I had to be like, and I want to be tested to make sure that I'm safe.
Yeah, and I guess that reminded me of something like when we're putting together a differential with somebody, of course, like we have a primary diagnosis that we think this is probably it, and then we have 3 or 4 others of like, yeah, I should probably rule this out, or like this is still pretty likely. And we're pretty good about that for most things, but I have noticed, especially with sexual activity, automatically STI becomes number 1 diagnosis. Like even in the absence of all other evidence. And I've even seen examples of this. Granted, this was in my first year of medical school when we didn't know anything about anything anyway, where I was given a case study by a friend who, like the case was chlamydia, and the only symptom was red eyes. And it's like I was supposed to somehow get from everything else being normal and having red eyes to suddenly, oh, well, I noticed you had unprotected sex, therefore chlamydia has to be my top diagnosis, instead of like going through the rest of what it could more likely be.
And even if that's the case, that like somebody had unprotected sex and they had chlamydia, I think usually I don't get the sense that doctors are like, I have, this is an area where I have felt judgment from doctors, my sexual behavior. And like, it would be nice if a doctor was like, oh, so like, not trying to like judge you or shame you. I think it's great that you feel empowered to have sex the way that you like to have sex. But considering you have unprotected sex and you're presenting with these symptoms, I just want to be safe and make sure that we're taking care of you. Do you mind if we run these panels to make sure that we can rule this out? That way you can like be carefree about that thing. That would be great. I love when doctors are like on fighting on your behalf. It's just kind of weird when they feel like they're trying to like wrestle you into submission on behaving in a way that makes their life easier. And I'm like, I'm not here to make your life easier. I'm here to make sure that I'm well.
Exactly. And I made a whole video about how patients aren't there to make your life easier. So I don't know if you watched that one yet.
I haven't. I'm sorry.
You're good. But I guess this question kind of also falls in a little bit with the previous question. Do you think it's safe to assume that your patient knows what is safe sexual activity?
I think it's kind of similar to one of the earlier questions when we were asking about like, are you sexually active? Like, I don't know what the best way is. I think it would be nice to see like maybe like some sort of medical clinic do like workshop this somehow to like identify ways to like in a non-condescending way, like be like, hey, like I don't want to assume that you're ignorant here, but just in case you aren't educated on this topic. Like, I want to give you the information so that when you're out there making decisions, like about your body and about the people that you let interact with your body, that you are like making the most informed decisions you can. Because like, maybe if you had this information, you would make a decision that you otherwise wouldn't have. And that seems important if you want that you would want to make decisions with the most information you can. Did that answer the question? I'm not sure.
Yeah, that answered the question really well.
Okay.
So the next question gets into some fun territory. So they want us to ask, how many partners do you have?
So this one's always a little confusing to me when I've had this question, because like, so being like a sex worker, I've had a lot of partners over the course of like a long time. And like I said, usually after I like have stopped seeing someone, or if I'm going to see someone new, I'll get tested again to make sure that like I'm safe and everything. Sometimes I feel like even I've had multiple doctors before when I'll be like, oh, like I've had like a lot of partners in the past, but like I've been tested and I'm clean. They still kind of want me to dig through and like estimate how many partners I've been with. And I'm like, is that really relevant? Like if I've gotten a clean panel and I'm not at risk for anything, I'm trans, so I'm definitely not pregnant. Like, that I don't really understand why you need to know, like, oh, like in all of my sexual history, I've had maybe like 30 to 40 partners. Like, is that really that important to you?
Yeah, like, because what I can gather with the purpose of asking this question is the association of multiple partners with STD risk, and which just kind of shows how far behind we still are in medicine, because it's automatically assumed, like if you have more than one partner, you need to think STI risk. And if they're monogamous, then therefore there's no risk at all.
Right. That puts so even more risk. Like, because like they could think they're monogamous, but they could have a partner who's going out and doing things behind their back, putting them at risk. Like, yeah, like I feel like this doesn't really accomplish the goal that it seeks to, and it possibly even misses actual potential risk factors.
So do you think there would be a different way to ask this, or do you think we just need to scrap this question altogether?
I don't really feel like this question is honestly that helpful. Like I feel like maybe like it would be more useful to ask like since your most recent partner, like have you been like tested for like any STIs or anything? Like what is like your history with, like maybe asking that, like what is your history with STIs? Like have you been treated? Have you had any partners since your most recent like test or something like that? That seems like that could be more useful and to the point. I guess you still have the risk of if someone's monogamous, they like their partner could somehow be getting them like infected with something, but yeah, I'm not really sure if that particular question, how many partners, serves the goal that it seeks to, or that it seems to seek. Maybe I'm missing something, but
I don't think you are. I think it's kind of a useless question, in all honesty, and I think it just further stigmatizes people.
Yeah, I agree.
All right, and the next question, and this is how people phrase it every single time. They say men, women, or both. There are a lot of problems with this question, and I know you're laughing about it as much as I am.
Yeah, this is literally not important at all, in my opinion. Like, if you're covering whether or not I have an STD or an STI, who specifically I'm fucking is absolutely irrelevant. Like, there's no, like, well, there might technically be like a statistically higher risk for like two men who are having like anal sex or something like that, right? But if you're asking like, oh, have you had an STI panel since your last like sexual encounter? And they say yes, and it came back clean, then what specific partner they're having the sex with doesn't matter at that point, right? Or am I wrong?
Yeah, and this brings up something else that happened, unfortunately, in real life very recently. Okay, I guess maybe I've had some questions about this, but my friend, who's a gay man, he got a question on his medical boards where basically it was making him assume that because somebody was gay in the question that they had like either HIV or entamoeba or something stupid. Like they were trying to get him to draw that connection. And I think I've had some other questions where it's just assumed that being homosexual makes you less safe. And even too, like with psych complaints, we get questions on that. The only times I've ever seen in my board's questions or on any test questions where someone has been LGBT, they've either had HIV or depression and nothing else.
Yeah. And to me, that's like harkens back to like, in like the like 80s during like the gay liberation movement, when like the Save the Family thing was really big, they particularly targeted this fear of women of having a bisexual male partner, because men who had sex with men might have a statistically higher risk of contracting HIV or some sort of disease and bringing it home to like their wives or something like that. To me, that just feels like it's like just like old school conservative propaganda that's still like floating around in people's brains. Like you hear this all the time. Like I before transition dated a woman who regularly shamed me. She was extremely abusive, but that's besides the point. She regularly shamed me and told me that I put her at risk. Like, even though I'd be like, I literally had STD panel since you first complained about it. There's literally no risk to you. She's like, oh, but you had a sexual history. Like these things are still in like the common like parlance. And like, it just goes to show that like even the medical establishment is not immune to like this kind of stuff and like purity culture and like these like propaganda pieces that are made to like make people fear like sexual engagements that like assuming that they're taking the right precautions are no more at risk than anyone else's.
Yeah. And then also with this question of men, women, or both, let's say somebody was trying to justify the use of this question to assess pregnancy risk. I'm guessing you're going to say that there are way better ways to assess pregnancy risk.
Yeah, absolutely. Like, is there a risk that is there a possibility that you're pregnant in any way, shape, or form? That seems...
Which is the next question, which we also ask.
Right. That seems to me pretty direct. Like, I think, like, I see you mentioned that, like, they assume that the patient could be lying, and like I guess it's possible, but it's kind of their prerogative. Like if they don't want to tell you, then they don't have to tell you. But like if there is a possibility, then like I think most people are going to be honest and they're going to be like, yeah, it's possible, or like, nope, I don't have a uterus, not possible.
Yeah, this is something that is there any possibility you might be pregnant is it's a hard question that like I've had to answer, obviously, because like I still have a uterus and I hate the fact that I have one. And I also like sexually prefer like people who don't produce sperm. So it's like, yeah, there's not really risk for me there, but I'm still asked this question all the time. I'm still given so many pregnancy tests, like literally anytime anyone wants to do anything, they want to get a pregnancy test. And it's kind of frustrating to have people like not believe me. And I've heard the same thing from people who identify as lesbian or bisexual, like how doctors just will not listen to them when they say that there's no possibility that they could be pregnant. And like, this is something also we get into with, a lot of medications require you, if you have a uterus, to be on birth control before you take the medication for risk of teratogens, like any kind of birth defects. So like one of them is acne medication. There are certain acne medications that require you to be on 2 forms of birth control, 2, not just 1. You have to be on 2 forms of birth control to get acne medication, which I'm good because I already have my face and my personality, so I'm set. But other people are not as fortunate as me. And I knew I was going to get you on there.
Yeah. I'm also curious because all of my documents now say I'm female. So if I go into a doctor's office and I'm like, I need acne meds, are they going to be like, gotta go on birth control? I'm going to be like, all right, I guess. So maybe, I don't know.
I mean, they'd give you more estrogen.
Yeah, I mean, it could work out. But no, I remember when I had surgery back in January, and I had to get COVID tested. And I remember the doctor was like, they was asking me pregnancy questions. They were like, oh, are you pregnant? Do we need to do a pregnancy test? And I was like, definitely not pregnant. I can guarantee you that. And I had to disclose that I was trans to this person because yeah, there was a certain persistency with the, are you sure? How do you know kind of thing. And it was I'm sure there's instances where that's really useful for heterosexual cis women. But yeah, I think there's a certain point where you have to be kind of similar to what we were saying earlier in a non-condescending way, be are you pregnant? And if they say no, you can be like, okay, I believe you, but just in case you're uncomfortable disclosing or something for any reason, I do need to let you know that there are these risk factors if you do happen to be pregnant, but I take your word for it that you're not. I think it can go a long way when they communicate I'm kind of stuck by the system. I have to ask you this question, but I believe you, and kind of going back to that, empowering the patient with just in case you're not comfortable disclosing for any reason, no judgment if you don't want to, you're allowed to lie to me. That is okay. You were that free. Just in case, here are how you can know what to do in that instance. Yeah, I think giving patients as much info and tools as possible is really helpful.
Yeah, and I definitely feel the pressure on the other side from this because, let's say we have a cis woman who's coming in with abdominal pain, and it's pretty much it's ectopic until proven otherwise. That is how we are taught to work through those cases, and we will get absolutely destroyed by the medical boards if we don't assume that. And if we, there's a lot of pressure on us to make those assumptions. And I know I've had some, I talked to you about this before, but I've had some interactions with other healthcare providers about this issue of, is it okay for our patients to lie to us? How do I make sure they're not lying to me? And something that I brought up with this person was, well, what are we doing improperly to make our patients want to lie to us about this?
Yeah. And I think at the end of the day, they are allowed to lie to you. We don't live in a country where if they lie to you, they're going to be arrested, for better or for worse. They have the right. So I think it's on the doctors to be all right, cool. You don't have to tell me anything you don't want to tell me, but just in case, I want to give you this information. That way, if you go home and you start thinking oh, maybe I should have been more honest with my doctor, you have tools and steps ahead of you to know how to make sure you're still going to get the best care that you can get from that point forward.
Absolutely. And I think this kind of can be approached in our documentation a little bit because, sure, let's say a patient tells you that there's no possibility they could be pregnant. We can document, say, patient said, quote, there's no possibility I could be pregnant. Mm. And so we can document that. And then, of course, we should ask them, do you consent to a pregnancy test right now? And if they say no, we can document patient declined at this time, that's language that another doctor on the internet actually made a video about. He was saying that we need to kind of stop using this terminology of patient was non-compliant because it kind of stigmatizes their independence and says oh, well, they were just being uncooperative. They just didn't want to give me any information. But there are multiple reasons why someone might not consent to something. And I think instead of
Absolutely.
putting the blame on them and saying, oh, well, they just were non-compliant, maybe say like they declined this at this time, saying that they can always accept later on and that it's their own decision. So what do you think about that?
Yeah, no, I 100% agree with that. Like, as nice it would be if people understood like, oh, this is what the doctor's trying to do. Like, I'm going to be compliant because that's going to give me the best outcome. Like, I know doctors are working on like, the data says this is the best statistical chance at getting this person the best healthcare. I think most doctors are operating from that principle. I think people generally, well, not generally, I won't go that far, but I think there are a lot of people who maybe are mistrustful of doctors because it feels like they are like giving them like their autonomy and things like that. And it's nice to be able to say like there, like you said, there could be multiple reasons why someone's rejecting a certain treatment, and you don't have to know why. That person might not be comfortable disclosing you. They might not be able to disclose to you. They might not even know exactly why they're doing it themselves. So giving them like the tools to like go from the best place forward after that is all you can do, and that is you giving them the best statistical chance at having a positive outcome.
So I guess I'm going to kind of bring this question that I added later on up just because it fits in better here. But kind of making this into a little bit of an ethics question, because I know you love to engage with people on those.
Sure.
So do you think that it is reasonable to require screening pregnancy tests for people who have the necessary anatomy to become pregnant in order to prevent complications when someone reports there's no possibility of pregnancy? Like, is it better to make that assumption and theoretically maybe save the life of a fetus, or is it better to respect autonomy and take the risk of not?
So I'm tempted to say that like in 99% of cases, I would say I would prefer to respect autonomy. I can imagine hypothetically that there are certain treatments or certain like procedures or something that might be in a situation where I'm like, okay, this one, it is like almost absolutely positively necessary that you have to get this done. And I think you can inform the patient like, look, most of the time, if you rejected it, although we would be bummed and that wouldn't give us the best tools, we would respect that. In this case, we absolutely need this to move forward with this treatment. I think you can level with patients like that and be like I'm not trying to trap you. I'm not trying to make you do something uncomfortable. I want to give you the best tools. That said, though, I think most of the time, the vast, vast, vast majority of the time, patients' autonomy matters more than anything. Like you can have debates about how conscious or alive a fetus is at any given stage, but at the end of the day, even if that child is born, you are not going to force a mother to be hooked up to a born child by machines to keep it alive. Like ethics and like autonomy is the most important thing, in my opinion. Like what I think morally of her decision is a completely different matter, and what I think doesn't even matter to like the fact of the case, which is like this person's autonomy is more important, and if it's not absolutely necessary, then I think you as a doctor can be like, look, this doesn't set us up for the absolute best chance of success, but what we're going to do is we're going to respect your decision and we're going to move forward from there with the best tools we have. Like I think it's valid for doctors to be frustrated, but I think it's far more important to respect the patient in the process. Like that's going to get you the trust to get them to be compliant, down the road.
Yeah, and I think people forget that autonomy is a key point in our medical ethics. Like when we are taught medical ethics, sure, we have beneficence and non-maleficence. Autonomy is on the list. So I think people like to throw that one away sometimes in favor of beneficence, but it's like there are a lot of debates that you can have about how you prioritize your medical ethics, but that's a whole nother video.
Yeah, for sure. Those things come into conflict sometimes too. But I do think at the end of the day, a patient's autonomy kind of always matters more, even if they're making what you might think is the worst decision. Like it's not your business to police their decisions. It's your business to give them the best tools from the decisions they've made going forward.
Absolutely. And I would agree with you on all of that.
Mm.
So I guess like the next couple questions are kind of just miscellaneous because I did have a workshop a couple years ago where we did we did these hypothetical situations where we would ask somebody their sexual history, and we had all different ages, all different backgrounds. And we got into the conversation of how young or old do we start asking these questions of our patients. And it was mentioned that we probably need to start asking younger than we think we do. So I guess, how young do you think we should ask? And kind of for different age groups, what questions do you think would be appropriate to ask?
Yeah, so my understanding of like what is typically considered good for sex education is that you can start at pretty much any age, but usually the younger you get down, it gets a lot simpler to where really all you're doing is giving kids the proper terminology to refer to their own bodies, like knowing what parts they have and knowing that their autonomy is extremely important. So if someone violates that, they can say to a doctor or their parent, like, oh, somebody violated my autonomy in this specific way, so that there is absolutely no confusion and adults know how to respond correctly. But damn, like from like a developmental psychology perspective, like kids start to be really into like the abstract and the thinking about their bodies and the future and stuff pretty young, like around like 11 or 12, I think it is, that kind of starts becoming a like dominant like mode of thinking. I think it'd be good for maybe even before that to start being like, oh, also like you're going to start hearing about these things, and like you're going to start having feelings regarding that too, and like we can talk about that, and I want to make sure that you know that like your pleasure, your safety, and your comfort are the most important things about sex. So if there's ever a situation where you're uncomfortable or where you're not enjoying it, or where like someone is violating your autonomy in some sort of way, that is a problem, and that you have a right to say, no, I want this to stop. And if like that doesn't happen, like there are like give them the tools and resources to how to like be their own best advocates.
Yeah. So something that was suggested in that workshop I had was like, because a lot of kids, like, I mean, adults feel weird talking about sex. So kids oftentimes feel really weird talking about sex. So it was suggested maybe taking an approach of not directly asking if they have been doing it, but asking more if they've heard anything about it, or if anyone they know has said anything about it or expressed interest in it, so that they can kind of ask questions without really giving it away that it's them that have those questions. So what do you think about that?
Yeah, I think as long as like the information is still direct and clear, like about like the parts and the autonomy and all of those things, I think if they have to like offload some of like the moral weight onto like, oh, my friend mentioned that he likes doing X, Y, and Z, what does that mean? I think that's probably fine. That's a way that a lot of kids might choose to navigate those things. I think it's also important though and I realize that our culture in general is really terrible at this, and this is something I think we all need to work on. I think it'd be great to see more parents being willing to talk, not like there's obviously a line, right? Like if you're telling your kids the things that you're doing sexually, that's wrong. You're crossing a huge boundary. But like if like you're watching a movie with your kid and like sex happens and your kid is like, what are they doing? You can be like, oh, they're having like sex. It'd be factual, you know, like you can really boil it down to like the raw information without like violating some sort of like comfort thing with your kid or like harming them psychologically in some way.
See, I love that you have the psych background too. That helps a lot. But
try.
I know it's been a few years probably, but
A little bit.
But are there any other questions that you think doctors should add to our list of questions?
Off the top of my head, no. I do think kind of we touched on it a little bit earlier. I wish doctors would be more forward about giving tools and resources to people, like availability of STD panels. Every single doctor I've had to advocate for myself and be like, they're not afraid to ask the questions on the list and to be like, oh, like this one's a slut, mark that on the thing. But like I've had to be the one who's had to be like, yeah, and because of that, can I get tested? It'd be nice if doctors were like, cool, so great that, like, we said this multiple times, but I think it's worth reiterating, like, cool, you like doing that? Great. I'm super happy for you that you know what makes you feel good, makes you happy. Considering there's a risk there, would you like a test just to be safe? Like, there's a way you can do it that's not condescending and not like shameful. Like, that's just genuinely like, hey, I'm looking out for you. I think that would be good. Like, seeing doctors do more to be like, I want to empower you so that like you don't even like you're always going to need a doctor, but like that way, you know, if you don't want to come here or if you can't for some reason, like you're still going to be safe and healthy and you don't ever have to like worry or panic over what's happening to your body.
Yeah. Thanks for that. And I mean, that kind of wraps up all the questions that I have. This was like really, really insightful. And there's a lot that I'm definitely taking from this. And I'm excited to do a better job than maybe I have been. And I don't know, because I always want to do the right thing for people. And like, I'm sure all of us just want to be good doctors. Like, I didn't get into this to be a shitty doctor, but there's a lot that we just don't know. And so it's nice to be able to hear from somebody else where we can do better, and then we can make those corrections. So thank you so much for coming on and talking with me about this. Is there anything else that you'd like to say to my audience before you go?
Watch all of Ben's videos on biological sex. That's what you should do.
I just got one out today, the first one on congenital adrenal hyperplasia. We're going to have like probably 4 videos on that. So I know the adrenal gland doesn't sound like it has anything to do with sex, but it absolutely does. Go watch those videos. Also, go watch Arden on all of the social medias. And if here you go, here's a plug for Transatlantic. If you're a doctor and you don't want to treat trans people, or you don't think we should be giving healthcare to trans people, or you don't think we should be using puberty blockers, call in to Transatlantic and have that discussion.
I dare you,
I love
coward.
I dare you too. So
double dog.
Thanks. But yeah, thanks you all for joining us, and we'll see you all in the next one.
Bye.